Good morning and welcome to Sickle Cell Foundation of Minnesota's Living Sickle Smart Virtual Education Series. We are so thrilled that you are with us today. We have another great session that we will focus on. We've been focusing actually all month on disease-modifying therapies and curative therapies in sickle cell disease. And we've spoken with experts and providers. And now we actually get to speak with another organization that supports curative therapies, and that is Be The Match. Some may know it by the National Marrow Donor Program, their long name. I love Be The Match. I think it speaks so well to their mission and the goals around why they exist in the first place. And we have three very special guests to bring to you. Before we do that, I want to make sure that I tell you all about our sponsors. And give me one moment here while I try to bring up my slides. There we go. And all right. So as I said, the Living Sickle Smart series, our virtual education session, we want to give special thanks to our partners and sponsors at, yes, Be The Match, Bluebird Bio, and Novartis. This is our fall and winter series that we are focused on throughout the remaining months of the year. We will focus on different topics. In September, we looked at sickle cell disease, a public health emergency. In October, the month that we are currently in, we are looking at, as I said, disease-modifying treatments and curative therapies. November, next month, we'll be talking about planning for your future, so transition. And then in December, smiling through the pain. So we're very excited about those topics. And today, as I said, we're excited to bring to you three very special speakers who will talk about the role of Be The Match in the sickle cell curative space. So without further ado, we have Jeff Oletta, and he is, one moment, Jeff Oletta is the Senior Vice President and Chief Scientific Director at Be The Match. We also have Tamra Weston, who is the Manager of Marketing with a focus on the African American community for Be The Match. And then we have Belan Jama. I hope I said your name correctly. And you are the sickle cell disease patient navigator. Each will come and tell us about what they do and how they make the world a better place, right? So go ahead, Dr. Oletta. I'm going to turn the controls over to you.
Great. Thank you very much for that wonderful introduction, Ms. Blaylark. We are definitely happy and feel privileged to be able to talk to this community about Be The Match and its resources for African Americans, in particular with regards to sickle cell disease. So thank you very much for that kind introduction. So the first thing is explaining a little bit about what the National Marrow Donor Program, or Be The Match, does. So I wanted to take some time in order to do that. So we are the nation's registry for donors. In other words, we were established roughly about 30 years ago with the help of the government in terms of becoming a donor registry for donors. So we're going to talk about that term in terms of donors. And donors, what I mean by that are people who altruistically go ahead and enter our donor registry and become donors for stem cells for other people. So that's the term of donors that I'm using. In particular, those donors provide their cells in order to cure disease in a transplant recipient. And that transplant recipient can have a cancer like leukemia, or can have sickle cell disease, and that's what we'll focus on today. So our mission at the National Marrow Donor Program is to save lives through cellular therapy. And our vision is to democratize cell therapy in order to do that. So with regards to summing what we do, so what we do is we match patients in need. In other words, again, the donors have gone to a donor registry in terms of in the community and have gotten a swab, in other words, a Q-tip on the inside of their mouth, swabbed it, put it into a tube and sent that to us. And what we do then is perform a HLA matching. We'll get that in a second in terms of what that means. And then we match that donor to a transplant recipient in need. And then we facilitate the donation and collection of those stem cells to be able to provide it to patients in need. In addition, what we do is we perform research and life-saving research in terms of making the field better with respect to allowing transplant to be democratized to other populations in the community. And we'll speak specifically about African Americans and sickle cell disease patients. And then again, I mentioned we have a registry, and then we collect these samples, keep them there in the registry, and then when there's a patient in need, we activate that whole process that's in front. So what do I mean by this HLA matching? It's a very complicated term, but simplistically, the way I always give this as an analogy to patients is it's like a letter. The letter only gets to where it goes if it has a specific address. So you write the address on the label and it matches to the address in the house that you wanted or the business. And so therefore the letter gets there. The same process with regards to matching. So God gave us a lot of things, and we have a lot of complicated things in our bodies. And the first thing is we have these address labels called HLA, or human leukocyte antigen, on our cells. And that's what makes us unique as individuals. And it's those HLA genes or address labels that we're matching between the donor and the recipient. So we want to have as best of a match in order for that to occur to provide those donor cells to those patients in need. So what is a bone marrow transplant? So I am a bone marrow transplant physician in pediatrics. I'm also an infectious disease doctor. And so I often have to tell or go over what a bone marrow transplant is for patients. And essentially it's two steps. The first thing, it's getting rid of the disease in the transplant recipient. And the second is restoring that disease with donor cells. And those donor cells are healthy cells. They could be healthy immune cells to attack cancer, or they can be healthy red cells to eliminate sickle cell disease. So what does that really look like? So I talked about stem cells the whole time. So our blood-forming or hematopoietic stem cells live on the inside of our long bones. So when you touch your arm, you kind of feel the hard part of the bone, and that's called the cortex. On the inside is a spongy layer of different cells. And some of these cells are these blood-forming stem cells, which divide, as you can see here, into red blood cells that carry oxygen from our lungs, platelets, which help us stop bleeding, and then also white blood cells, which allow us to fight infection. So these stem cells actually reproduce themselves, and they divide into themselves as well. And it's very important to have this because these circulating cells, the white cells and the red cells and the platelets, only last a little while. So if we didn't have this master stem cell that makes itself and divides into these circulating blood cells, we would die. So we need these master stem cells. So we can collect these stem cells from three different ways. The first is we can do a bone marrow harvest. In other words, the patient or donor goes into the operating room, and we go inside that spongy area of the bone and aspirate back, and that's what bone marrow looks like over here. And we put it in a bag, and then we ultimately infuse. Or we can use peripheral blood stem cells. And what that means is what we do is we mobilize those stem cells to leave the bone marrow and enter the bloodstream. So how do you do that? So the analogy I give to this is the hematopoietic stem cell, or that blood-forming master cell, is like a boat at a dock. And the reason why the boat doesn't go into the bay or river is because that boat is tethered by ropes to the dock. And so we use chemotherapy, or in this case, a drug that comes and clips the rope of the boat, which is our analogy of the stem cell, so that the stem cell leaves the dock or the bone marrow and enters the bay and ultimately into the river, which is analogous to our blood system. And then what we can do then is collect those peripheral blood stem cells through a process called apheresis, where those cells leave the body, go into a machine that spins the cells and literally takes off the white blood cells. And in that white, or in those white blood cells, are these stem cells that go into a bag and then we can infuse into a patient. And then lastly, we can collect stem cells from umbilical cord blood. And that's what you see here. Here's the umbilical cord, and we clamp it and we take a syringe and we aspirate back and get those stem cells, as you can see here. So then what we do in the terms of bone marrow transplant is we want to give those stem cells to a patient in need. In this case, let's talk about sickle cell disease patients and them getting a bone marrow transplant. They're in need of those healthy red blood cells that a donor has. And these are what healthy red blood cells look like. But the sickle cell patient has the sickle cells here, as you can see here. And as you know, sickle cell disease causes lots of complications in the body. And ultimately, the point of bone marrow transplant is to give the healthy, good red blood cells to the sickle cell patient and replace their sickle cells so that they have the healthy red blood cells, as you can see here. So there are complications to bone marrow transplant. Without a doubt, it is a high-risk procedure. And when we talk about bone marrow transplant to patients, in particular sickle cell disease patients, we have to talk about those potential complications. So some of them are listed here. So the first thing is those those stem cells don't take in the recipient. In other words, that graft or that bag of stem cells that we infuse into the patient, what has to happen is those stem cells have to find their way from the bloodstream and go back into that bone marrow part, the inside of the cortex, and repopulate themselves and become the circulating red cells and platelets and white cells that I just said. In graft failure, it means that the donor cells don't repopulate the bone marrow and therefore don't create the circulating blood cells that we want. So that's one complication potentially. The other is graft versus host disease. So again, that bag of stem cells is called a graft. And inside those stem cells, or inside that bag, are stem cells from another person. So we have made the matching of those cells with the donor recipient. But in the end, there's lots of other address labels which are different between the donor and the recipient. And what can happen is there's such a difference that those donor cells recognize various tissues in the transplant recipient as not its own and literally attack those tissues. Some of those tissues can be the skin, for example, or where the stomach is, or intestines, and also can be the liver. We do have medication to prevent graft versus host disease, and usually we can, but it still occurs. And then we have to use medication to treat graft versus host disease. And I can tell you there's been many kids that I've taken care of over the years who have had graft versus host disease and still have lived. So some of these complications are life-threatening, but for the most part, we can treat these complications after transplant. So I mentioned graft versus host disease, so infection. Remember, we're taking away the bone marrow, and inside that bone marrow are these white cells which help fight infection. So when we do that during bone marrow transplant, we increase the risk of infection because the patient no longer has their white blood cells. And so we have to wait for those donor white blood cells to kind of take inside the bone marrow. And during that time, before engraftment of those stem cells, there's a high risk of infection. And there's even risk of infection after transplant because it takes a while for those white blood cells to restore themselves, both in terms of the amount or number of those white blood cells, but also how they function. So the best analogy that I give with that is a stadium. Think about a stadium. Think about a stadium that has about 100,000 seats in it. What we need are those 100,000 seats to ultimately be filled by the donor cells. That's what we call engraftment. So those donor cells have engrafted, have found their seat in the 100,000 seat stadium. And so then you can hear the roar of the crowd, right? But we can hear the roar of the crowd with about 50,000 people in that stadium. But what we want ultimately is 100,000 people in that stadium. And so until we get to that 100,000 number, to get that high roar or restored immune system, there's always going to be a risk of infection until everybody can get filled up in the stadium. And then lastly, issues in terms of bleeding, again, not having enough platelets. And then also what we call is disease relapse, where we've given the graft, but unfortunately that recipient, that transplant recipient's disease comes back, usually in the form of cancer in terms of cancer patients. But with graft failure for a sickle cell disease patient, the patient rather can have sickle cell disease again in the context of graft failure. So definitely there are complications to bone marrow transplant, but usually we can treat them, but we certainly have to educate everybody who goes through a bone marrow transplant. So next, I want to talk a little bit in terms of the services that we provide in terms of barriers to cell therapy. So I first want to start with this slide. So it's a little bit busy, but I wanted to go through it with everyone. We talked about donors. Well, you need a donor in order to have a bone marrow transplant. So that's a barrier to transplant if you don't have that donor. So let's first focus on donor availability, and the rest of my colleagues and speakers will talk a little bit about this as well. So we know in our registry that the chances of matching are higher in white Caucasian people like myself versus Black African American people. And the reason for that is because the registry has just a higher number of people who are of Caucasian race who have gone through that process of a cheek swab rather, and put that in the tube and send it to us. What we need, and the reason why we're also here, is to educate folks in order to give that curative therapy for sickle cell disease. We definitely need more persons of color in our registry. And that's another reason why we're here, is to get you to think about that and to join the registry for that purpose. The other thing that I wanted to mention is there was that census report. Remember when we had to go online and fill out all those questions in 2020, or fill in the ovals and mail it? What we found out is that not only what we found out rather is the diversity of the US or United States in terms of its population is increasing, which is such a great thing. In other words, what that means are there are persons of color who are marrying Caucasians, for example, and vice versa, and having kids, which is a great thing. But what that means for us in terms of those address labels, that means it gets more complicated because of that intraracial relationships. So that means we have to think about research in terms of alternative ways of doing that bone marrow transplant that I mentioned, as well as novel ways of doing it to decrease graft versus host disease. So that's a little bit beyond today's talk, but that's part of that research element of Be The Match that I help lead and everybody contributes to there in terms of making transplant more available to persons in need. So I'm going to stop there and hand the baton to Tamara.
Thank you, Dr. Oletta. Good afternoon, everyone. As Dr. Oletta shared, we are all here today to talk on behalf of Be The Match. My role at Be The Match is the marketing manager for the recruitment side of Be The Match. I am here to give you a snapshot of the Be The Match registry and to briefly walk you through some of the ways we reach out to members of ethnic communities in our efforts to build brand awareness and increase the Be The Match registry. Next slide, please, Dr. Oletta. Yes. So the primary focus of the Be The Match registry is patient access. Through the World Marrow Donor Association, the WMDA, every search throughout the registry provides patients with the access to more than 39 million potential stem cell donors worldwide. Although the Be The Match registry is the most diverse, it is not the largest. However, Looking at the US alone, there are more than 9 million potential stem cell donors on the Be The Match registry. And that is where we'll concentrate our conversation today. Next slide, please. As Dr. Oletta alluded to earlier, over the past few years, we have seen a shift in the Be The Match donor registry. But the one thing that has remained constant is that African Americans as an ethnic group continue to hold the title of the ethnic group with the lowest chance of finding a match on the Be The Match donor registry. As you can see by the slide, the chances of an African American searching patient is 29% and is significantly lower than that of a white searching patient who has a 79% chance of finding a match. However bleak this may seem, we did recently see a 6% increase in potential match rate, as the previous match rate for African Americans was 23%. But in the same realm, the match rate for whites was 76%. So we saw an increase there as well. With African American and white searching patients as bookends, we can also see that in between, we have a range of 47% to 60% between Asian, Hispanic, and Native American searching patients in that order. Clearly, African Americans are not only alone in the disparity, but they are continuously the lowest. As we drill down further, the odds of finding a match on the Be The Match registry are determined by the number of people on the registry. Next slide, please. As you can see by this pie chart, the ethnic makeup of the Be The Match registry is dominated by white representation. Currently, white registry members make up over half of the registration with a 57% penetration on the registry, followed by Hispanic or Latino registry members who make up 13%. With Asian registry members coming in at third with 11%, and African Americans holding a bottom position with 8%. Now, while I highlight the numbers, because we know numbers do tell the story, our focus as a whole is never on just increasing the registry through one ethnicity. The goal is always to remain as diverse as possible so that every searching patient, no matter his or her circumstance, has the best chance of finding a match on the Be The Match registry. But the truth of the matter is, where we stand today, the disparity that we are charged with changing is what you see before you. We need to increase the registry numbers so we can increase the chance of finding a match for all ethnic groups. Next slide, please. Why is Black representation so low? There's a number of reasons that we could discuss, but we're going to focus on these 4 because these mainly seem to outroot any other barriers that we have come across or learned about. So when we think about the number one reason, it is the mistrust of the medical community. For generations, African Americans have had a deep-rooted mistrust of the medical field. As noted in a Be The Match video that we will show you shortly, there are a number of recorded incidences that solidify the fear of inadequate services and care. And as an African American, I can tell you those are true. They are passed down from generation to generation. I heard about it from my mom. My mom heard about it from her grandmother. I heard about it from my grandmother. It is a pure fact. So what are we doing about it? We at Be The Match recognize that there is a cultural identity and work daily to communicate understanding with a desire to build trust within the AFA communities, because we do need the trust. Number 2, anxiety about the donation process. There are a number of myths and facts about bone marrow transplant. The number one myth that we hear often is pain and the level of it. As Dr. Oletta shared with you earlier, there are 2 ways to donate the stem cells, 3 ways. We're going to talk about 2. Number 1 is the PBSC, and then the second is the bone marrow transplant. What we have learned is that from previous donors, actual donors, that the discomfort from both procedures is different for everyone. And many former donors have categorized the discomfort as being overly tired, with time needed to rest, or sensitivity to the operated region similar to a slight bruise or overworked joint. But no matter what the pain level is, we do not discount that there is pain. It is dependent upon the donor and their level of pain that they can absorb. And we are honest and open about that as we reach out to the communities. Next is unawareness of Be The Match. As Dr. Oletta also alluded to, we've been in service for 30 years. As a matter of fact, although we are approaching our 35th anniversary, our brand awareness is very low. Based on a survey done earlier this year, pre-COVID, we had a brand awareness rating of 6% among the African American community. What are we doing about that? Well, Be The Match knows we need to increase brand awareness and trust so that we can empower a growth in ethnic numbers from the African American communities and their families and their networks. And then lastly, state of the world, uncertainty of what tomorrow will bring. 2020, no doubtly, was a year filled with unexpected turns and outcomes that had numerous effects. As a nation, we continue to lean into our learnings. We're still trying to navigate and adjust to what many of us now know as the new norm. We still have some time to go before we collectively as a nation reach a level of comfort in the aftermath of all that has happened in the last 2 years. Be The Match will continue to push forward with its mission and partner with community organizations and government offices to ensure that our goals of disrupting the disparity are reached. We will optimize our strategy where needed and utilize our resources to the fullest extent where and when possible. Next slide, please. Now, as I noted a few moments ago, 2020 was a year filled with what most people will want to forget, but probably never will. I mean, how could we? We went through social unrest. We've had an economic downturn, the presidential election, and of course, the pandemic that has directly impacted over 700,000 families and touched the lives of over millions of people. But before the world went into lockdown and hundreds of corporations and organizations pledged to join the fight for equality for all, Be The Match recognized and took a stand against the health disparity that was moving to the forefront. Be The Match increased its efforts to engage and communicate with the African American community. Among the numerous things we did, we created a 2020 Black History Month video with former Miss America of 2019, Nia Franklin, who was a donor for her father, who suffered from non-Hodgkin's lymphoma, which is another type of blood cancer. We would like to show you that video now. Please play the video. Sound.
Dr. Oletta, if you stop sharing and then go back into sharing, there's a box at the bottom for sharing sound. So if you stop sharing first.
Whites Only Hospitals, Tuskegee Experiment, Henrietta Lacks. The history of American medical practice is riddled with horrific examples of injustice and exploitation of Black Americans. To combat the systemic abuse, African Americans have organized to take care of our own, creating world-renowned medical colleges and universities, opening neighborhood clinics, and sharing health information. One of the finest examples of the Black community caring for our own is more than 10 million African Americans who have signed up to donate life-saving blood stem cells, the only known cure for sickle cell, blood cancer, and other deadly diseases. As more African Americans gain access to this life-saving therapy, More Black donors are desperately needed. Celebrate Black history by learning how you could be someone's cure.
Thank you.
Whites-only hospitals.
Okay. Yes, and that is one of the many things that we're doing as we try to continue outreach to African American communities in terms of engaging and understanding the culture and the history that is maybe delaying them from joining the registry. But in addition to that, we're also going out and we're listening to the communities, and we're listening to what they say, we're listening to their fears, we're listening to their concerns. So when the communities speak, how do we acknowledge those concerns? How do we address them? As our Black History Month video stated, Be The Match recognizes and acknowledges the generational systematic mistreatment of African Americans by the medical field. There is a deep-rooted fear of the process. Be The Match is committed to learning what we can to help remove this fear. We have conducted extensive research to learn about the members of our registry, particularly the type of people who join the registry and why. We want to understand and learn why some join, some don't, and or won't. This helps us in our communication. It gives us an opportunity to engage and provide the info a potential registry member needs to know and or hear to help him or her make an informed decision to join to not only join the registry, but to be committed and donate when called. To join the registry, you must be 18 to 40 years old. The most preferred age for registry members is 18 to 34 years old, with a slant towards male donors. Stem cells donated from a younger male donor of any ethnicity has proven to be stronger and aid in a quicker recovery of the recipient. So as we look at the personas of both African American and female potential donors, as you see before you on the screen, what we find is the following. African American men need to be confident in the process, but they currently have a low trust in the medical field. In order for him to commit to join the registry, he needs someone who looks like him to be a part of the process. They need to fully understand how participating will impact him and his community. When we look at AFA women, we see that she also needs to understand the process and what happens to her. She wants to help others who look like her, as most African American women, or most women in general, are nurturers. We want to make everything better. We want to make everything okay. We want to heal the sick. We want to strengthen the weak. So in order for her to commit to join the registry, she needs, similar to an African American male, someone who looks like her to be a part of the process, to understand the medical risk and her post-care if needed, because she has also an underlying fear of medical industry. And then last, but she needs a full scope of understanding of the donation process. So when we look at what is needed to convert, we see the commonalities having an African American advocate during the process and understanding the possibility of pain. I will add here that when my team and I go into the field and we host live drive events, it does make a world of difference if we are in an African American community and someone, particularly me, is at that table. We get a bigger response, we get a bigger crowd, we get more people engaged and want to ask questions. It does help. So as we continue to close the disparity gap of our registry, we will concentrate on 3 areas of growth. Brand awareness. We need to build our brand awareness among the communities we are trying to serve. Brand trust. We need to build a long history of trust. We need to be there for the long haul. We need to provide support where we can among the communities that we serve, so that it's not just as if we are just taking, but we're also giving. And then last but not least is education. We need to understand the fears of our target audience and be able to provide education on the myths and the facts. A lot of times when we go into communities and we host conferences or webinars, we speak in a medical tone. We need to speak in a way that the members of that community that we're speaking to can hear us and understand us, and not be fearful of asking a question because they don't understand a word or term. So we need to recognize that when we speak to the community, we have to speak in the language that the community speaks. Now that I have shared with you some of the top line issues that make up the registry disparity and the gaps that we saw, I will pass it over to Bilin Jima, who is a patient advocate for the Be The Match community, and she will walk you through Be The Match's patients' resources and support. Bilin?
Thank you, Tamara. That was awesome. So now let me share a little bit about myself. I am Bilin Jama. I am one of the sickle cell disease navigators working to support warriors and caregivers. And I will be talking about the work that I do and also the resources that we offer. So we do have a sickle cell warrior program. The goal of this program is to reduce the barriers that exist in accessing treatment, particularly with curative options. So how are we doing this? Our sickle cell disease program is raising awareness about transplant as a potential option by partnering with community-based organizations, partnering with like attending conferences, speaking on panels and spaces where sickle cell disease warriors and caregivers are, creating educational materials and sending out these materials so people have access to them. And what are we doing to reduce the barriers to care, actually reduce them? We are offering navigators as a support, as a listening ear, and resources, and I'll get into that later. Dr. Oletta, the next slide. So Courtney and I, you'll see a picture of us here. We're both sickle cell disease navigators. We make calls, we take calls from sickle cell disease warriors and caregivers throughout their treatment journey. And so when we're talking to warriors and caregivers, we are, sharing, first of all, we're actually listening to hear what barriers might exist. And then we are identifying solutions that are available. So, we know we constantly hear about barriers, but what are they? And what we've heard them to be can include isolation, it can include financial distress, lack of support, provider stigma, having multiple hospitalizations, and just a lack of education about their treatment options, what exists. So when Courtney and I are hearing these barriers from warriors and caregivers, we're thinking, okay, what might be helpful for them? What can we offer that Be The Match has, and what is out there? So I'll go into more of that. I know I keep saying that, but if you can go to the next slide, Dr. Oletta, I do want to share that we do have a sickle cell disease warrior package. And with this, caregivers and warriors can request by going to sicklecellconnect.com. And in the package, you would get educational information, a pen, appointment journal, warrior stickers. But what this follows up with is a call from Courtney or I to be able to have a conversation and start from there. So then we can, kind of assess and see, are there any barriers to care? Do you know about, transplant centers in the area? Sending educational information, answering any questions, and then connecting to our internal resources. So let's get into those resources now. Next slide. So first, one of my favorites is our Peer Connect program. This program connects warriors and caregivers to our trained volunteers. These are people who have firsthand experience. Only really someone who's walked the walk can really share with you what transplant is like. So, these volunteers are able to provide meaningful support by listening to sickle cell warriors and caregivers, answering any of those questions that they might have, and, just sharing their own transplant journey. So that's the Peer Connect program. Next slide. We do have free one-on-one counseling. We're aware of the different kinds of emotional health struggles that are faced by sickle cell disease warriors and caregivers, isolation being one of them. And to alleviate that, we have free one-on-one counseling. So we have social workers who understand the challenges of living with a blood disorder, who can talk you through emotional, social, practical, related things to sickle cell disease. And they improve quality of life by, helping manage financial challenges, improve communications with your healthcare team, learning new coping strategies, things like that. So, and this is available to warriors and caregivers. Warriors must be older than 18. Next slide, please. So we have our clinical trials search and support program. So let's say you're an adult with sickle cell disease, you're interested in transplant, you want to know more about trials that are out there and how to join them. Where do you find them? Right now, going to the government website to look up sickle cell disease related trials can be so exhausting, can be so overwhelming. So we do have this program to support. What it includes is like an online tool where it's easy to navigate and see what trials are out there. But also you can work one-on-one with a navigator, a clinical trials navigator, to kind of understand what the process is and learn how to join it. So you're not feeling lost, kind of caught up in the mix. You do have some guidance and some support with that. And so our navigators can provide educational resources, help you learn more about the research that's out there and new treatments that are out there for sickle cell disease. Next slide, please. Financial grants, financial hardships not only cause emotional distress, but they can definitely get in the way of seeking and getting treatment. So like if you have issues getting to your appointments, transportation is a problem, then you're unable to fully participate in your care and in your treatment. So things that we offer is financial assistance to those seeking transplants or in a clinical trial. And what these funds can help with include ground transportation, temporary housing, HLA typing, and things like that. So we are here to support and can definitely provide more information about this if you were to call in. So next slide. Leading into that, please call us. We are here to support. We love talking to warriors and caregivers, just being a listening ear, as I've mentioned before, and also just brainstorming what is out there to help. So don't shy away from calling us. Dr. Oletta, do you want to take it away and finish us off?
Sure. Thanks, everyone. So the other thing that Be The Match, as you can tell, we offer services, we offer education. And I can tell you as a physician caregiver, those services have really benefited my patients, whether they are cancer patients and whether they're sickle cell disease patients. But I think fundamentally, as Tamara mentioned, in terms of what's been going on with our country for the last couple of years, it really has highlighted healthcare disparities. And this is so crucial for us to really address holistically across all of the country and even the world. And we really need to think about ways to offer cell therapies, to offer transplants for everyone, for persons of color, for persons in need. And the way that we're going to do that is by decreasing healthcare disparities. So this is the last slide of the presentation, but I think probably a very important one to show you that Be The Match is invested in decreasing healthcare disparities by the services we offer, by government advocacy, which we haven't even talked about, but we have a whole government affairs group that really promotes bone marrow transplant for all peoples, all persons of color. And then we have outreach programs as well, and then research, as I mentioned. So Be The Match has an intrinsic mission in order to reduce healthcare disparities because we as a country have a moral obligation to do so. So I wanted to end on that note, and therefore I will turn it over to Ms. Blaylock.
Thank you so much, Dr. Oletta. Thank you, Bilan. Thank you, Tamara. This was amazing. Like the amount of information that was given here. If ever I didn't understand all of what Be The Match is and what you do, this was fantastic. And Dr. Oletta, the way that you painted pictures, the way that you used the boat and the rope and the envelope, I mean, all of those truly help us to better understand, first and foremost, what is bone marrow transplant? Why? How does it work? And how would it work in something like sickle cell disease? But it also helps us understand how complex it is, because the reality is that this is a complicated procedure, but it is a therapy that has worked and will continue to work and will continue to grow the science. So thank you so much. And one of the things that I'm wondering is, when we look at those disparities, those are gross disparities, right? And they're quite significant, and they are very consistent over the years. That so we know that there's complexity even in moving the needle of those disparities. Do we think that some of what created that disparity is almost a lack of understanding or awareness? Do we think that it's improvements in access to care, over the last 10 or 15 years, and the curative therapies through research and improved technology? Does that impact the demand for matches in many of these communities of color? Because in my mind, it's like, okay, my son's 25 years old. 25 years ago, not only did I not know what stem cell transplant was, but I certainly didn't know that it's something that we can pursue, that we can look into and ask questions of. Do we think that that may have impacted the head start that some communities got in signing up for it, and in their understanding of it?
Yeah, I think that's a great observation. I think the kind of the message is education, right? Education is so powerful. And that education, I think, has come in many different forms over the last several years. And yes, there's definitely a reach out to communities, which is part of that education, as Tamara was mentioning. And then there's also kind of that education that comes with regards to being able to provide a complicated service to people, meaning that it is access to therapy. No doubt about it that has been a major hurdle in terms of being able to provide this life-saving therapy, because a lot of times even physician caregivers today will think that the risk is too great for a patient to undergo bone marrow transplant. But when you think about the risk of severe sickle cell disease, that's a very high risk as well in terms of stroke, for example. And so therefore the risk of not doing anything is sometimes outweighing the benefit of doing something that has a risk associated with it. So I think there's an education component. I think there's an outreach component. I think a lot of those things have changed over the years, as you're mentioning. And I think that is partially the success story, is that education element. But I'd love to hear from Tamara and Bill on as well.
That's a very good question. And I think that there's many different ways to answer. And as I sit here to try to formulate the best, I think that when we talk about access and when we talk about providing it, I think we, over the years, we focus on this word called equality. We focus on being able to say, well, you can do it and you can do it and you can do it. And that's easy to say. But what we really need to think about is equity and the difference between the two. You can have the equality. Yes, you can tell me that this is available, but if I don't have the resources to either afford it, or if I don't have the resources to either participate in it, then it's not of value to me. So I think when we talk about equality and we talk about equity, we need to understand that for some communities, particularly ethnic communities, there's a gap between that. There's a gap between the equality and the equity. And I think that once we begin to bring them to the same level, when we begin to align them, then we'll see that shift that we need. Because for right now, African Americans, it's not just not having access to the registry, but even when you do, can you afford it? And going to Dr. Oletta's point, we can help with that. And Bill's point, we can help with the resources of the financial burden. But if you don't even know about it or even to ask about it, then how are you able to say, I want to participate in this? African Americans and ethnic groups, they suffer with, low income. They are honestly on the bottom of the totem pole. So if they don't feel that they can climb up to reach that equity, then they're not going to do it, because it's almost like they don't want to be let down. It's, if you think about it in terms of for clarity, equality is being invited to the prom. Equity is being asked to dance. So when you think about it along that lines, that's where you can kind of see visually the struggle that's happening within the ethnic communities.
I love the analogies, and I love the way that you all paint the pictures, because it really brings a level of understanding on all sides of the table, right? Because the equity and equality is a common theme that runs through all systems of inequity, whether we're talking healthcare, education, the justice system, right? And so thank you for bringing that out. And access to care is not just does it exist, but it's how do we ensure everyone can get there, and what assistance is needed for each group and individuals in order to get to it. Access is such a bigger word than what we've oftentimes assigned the meaning to. So thank you very much. Another question that I have is, we know that the Black and Brown population, particularly people of African and African American descent, we're not a monolith, and there's we have subgroups within the group, right? And so, are there subgroups within the African and African American population that are targeted differently? And then how do each of those groups, or could each of those groups, impact responsiveness? So, when I'm thinking of some of these subgroups, I'm thinking, you have individuals who have received transplant. You have individuals who have donated and joined the registry. You have, young adults versus older adults. You have, churches, and then you have schools. And, how is Be The Match identifying some of these subgroups and utilizing them in those spaces to help increase education and awareness?
That is a very good question, and that is another strong journey that we have embarked on. So yes, number one, I think it should be clear that we know that we cannot target African Americans the way that we do general market. It just doesn't work. So we need to go into those communities with a different language. And when I say different language, I don't mean not understanding. I just mean we need to talk in what is known throughout that culture. So that's one. So overall, the African American community is targeted from a different scope. The second is, as I noted earlier, the age to join the registry is 18 to 40. So we kind of skew younger. So when we're talking to a younger audience, whether it's an HBCU, whether it's in high school group, once again, we're sharing with them the value, the importance, the need to join the registry in a way that they can understand. Then, as you talk about donors and recipients, We do target donors and searching patients because we need them to become our advocates. So we now have a role for them as an advocate. So they can go onto the website, they can go onto the registry site and not join as a donor possibility, but more as an advocate, where then they will now take what they know personally and what they've learned and take it into the community that they are affiliated with, whether it's a church, whether it's a corporation, whether it's, you know, a school alumni. That's what they do. And then when we talk about people that just don't know about us, that's a different sublevel, because now we need to come at them with an educational conversation, meaning we understand the culture, we understand the past, we understand your fears. Here's how we're going and willing to work with you to overcome that, because in essence, we need you, but we understand you may need something from us, and we want to make this an opportunity as a win-win. And that's how we do a lot of our campaigns, and what we do is based on a sustainability module. We don't want to just come in and see you one time. We want to be able to know and let you learn that you can trust us. We are a valuable resource. As Billin talked about, we have a number of resources that can help a number of people. So we want to be able to expose communities to that so that they feel free to at least try to learn a little bit more about it.
Wow, that's excellent. And you know, that's a comprehensive approach. It's not through one lens, but it's through multiple lenses. And it's, you know, when I say that we're not a monolith, meaning we're not all the same, we don't all necessarily speak the same language. And we can be talking about, you know, lots of different languages around the world, or we can talk about, you know, cultural understanding and how we relate to and how our worldview impacts how we talk about some of these issues, right? That's language as well. And so thank you. I mean, it's clear that Be The Match has put quite a bit of effort and resources. The fact that you all's roles exist, Tamara and Bilan, the fact that your roles exist within an organization like Be The Match speaks to how important that this discussion is, and the fact that people in positions of power, let's call that out, people in positions of power have recognized that not only do we have to see it, but we have to do something about it. And doing something about it means that we have to put funding. There has to be goals around that. We have to measure our success. We have to look for areas of opportunity. And so, you know, I want to make sure that I call that out and I say thank you, because it takes organizations like yours who step forward to be leaders in that particular space around health equity. Another question that I have, and this is for Bilan, and that is, can community members who are not warriors or caregivers sign up for the Sickle Cell Warrior package? And then I'm going to circle back to several of the supports and resources that you talked about.
Yeah, can you hear me?
Yeah.
Okay, yeah. So at this time, it is just for caregivers and warriors, because when they do request it, they're getting a call from Courtney or I. So if they're just a community member and they just want to talk to one of us, then they can request it. But we're specifically kind of targeting our warriors and caregivers so that we can follow up with a call, kind of learn more about where they at, and let them know about the resources that exist, how to have that conversation if transplant is something that they're interested in. So at this time, specific to warriors and caregivers, yeah.
And I think that that's fair. I asked that question because I wanted to call that out. I wanted people to understand that, you know, by ordering a package, you know, it also puts you, it connects you to people as resources. So it's not just that you're receiving these items that you'll, you know, tangible, you'll hold in your hand, but it also means that you're going to be able to look through those materials, and you're going to be able to ask a live person a question, because someone will reach out to you. So thank you very much for clarifying that. And then my last question, and I think that this is a very appropriate question to end on, because one of the things that I've noticed, just, sickle cell disease is, I often say, it's the intersection of all the isms in our society. If it's an ism, it probably falls. Sickle cell, there's conversation that relates to sickle cell and how it impacts quality of life for individuals. And so it's easy when we identify many of these disparities to go back to the groups and say, what could they do different, right? But we also have to look at the systems that exist. And so I know individuals and families who have actually gone through transplant and never learned of Be The Match, right? For me, that speaks to the healthcare industry's utilization of Be The Match outside of just the match, right? I saw that circular continuum that you showed in what you do and how you do it, and that making the match happens a lot behind, other than the swab, right? The science of it happens behind the scenes, and it's working with the transplant doctors and the team. But how do we increase the clinical team's understanding and use of Be The Match outside of just the match, but as a community resource for individuals and family? There's a huge gap there. What can we do about that? And how can we help from the community's perspective as well?
I'll start, but please, Balan and Tamara, definitely chip in. I think you're exactly right, Ms. Blaylock. And that is, typically, again, as a transplant physician, I would be going to Be The Match in order to find a donor or an unrelated donor for my patient. But I didn't have the intrinsic knowledge of all that Be The Match offers in terms of that continuum of services that Balan and Tamara were mentioning, and also with regards to support for patients. And so I think the first thing is educating transplant centers. And that's what we have a couple of positions now in the company that are actually doing that, going out to transplant centers or doing webinars on our services in order to provide them education. I think the one thing that gets into, and not the one thing, but a point I want to make, are social workers are like the angels of God. I have to be honest with you. But there are so few of them at the transplant centers because of the fact of resources. And so we can actually help out the social workers. We actually serve the purpose of a lot of the roles of those social workers. So I think that's another message that we can provide. In other words, transplant center, you don't have enough social workers, but hey, we the batch can actually provide services that your social worker can provide to more patients. So I think it's that messaging, that education, where we can go out and provide that. But I do think the other thing that Tamara was mentioning, which is brand awareness, right? I think we need to go out and promote our brand and make sure that people understand it's not a dating service, right? It's actually a health service in terms of matching a donor and with the transplant recipient. So we have to do some brand awareness with that.
I think that that's wonderful, and I think that it takes all of us, right? As they say, it takes a village, and we are all in the healthcare space in one way or another. Whether you are a patient, whether you're a caregiver, whether you're a provider, or you're part of that medical team, or you're a family member, who is involved. So we all play a role. And one of the things that I will wrap us up by saying is, I encourage us to go even further upstream. Like, it's one thing to talk to the transplant team, but what about the hematologist who's talking to the patient, who has to make the referral? And how are they determining what is medical necessity? That what motivates both people, right? But particularly groups of people who have many socioeconomic factors that impact how they make decisions. Is you have understanding of the medical complexities of why transplant may be necessary, but then what are the psychosocial impact of living in Black and brown bodies with a disease like sickle cell disease? And maybe that's the motivation. Maybe it's not that my child child has had all of these complications, or we can't get through the complications of the disease, it's an added layer of complications as we navigate society at large. And so utilizing that as part of the conversation and helping providers to understand that when they are considering who to refer to get a consultation, for this potential life-saving treatment, that we have to look outside of just, have they had a stroke? Do they have high transcranial Doppler and TR jets and all of the science behind it? But what is the life that they will have to live as a person, with sickle cell disease every time they encounter the healthcare system, every time my child encounters, trying to get a new job, or as a young person or an adult trying to keep their job, those types of things that also impact. One of the things that I would tell my team, regularly is everyone deserves the right to have a consultation, whether you think that they are eligible or not. Why? Because knowledge is power, and the absence of knowledge is oppression, or it has been used as an oppression in our community. And so I love that you're focusing on education and awareness, because that's where it starts. Decisions are often made not before we get the education. We got to get the education first, and be aware first, and then we can make more thought-provoking decisions and ask the questions that we need in order to make informed decisions. So thank you so much. This was incredibly thorough. I cannot wait to get it up on our website and on our YouTube channel. I'm going to bring it up right now just to make sure that you all can continue to connect with us. And yes, I'm talking longer because I cannot find my slide, but I'm going to find it. And I probably just closed it, but I do want to remind you all, here we go. I'm going to bring it up here. I want to remind you all that you can access previous and future sessions of our Living Sickle Smart by, oops, hang on. As I'm talking, I'll bring it up. See, this is what happens when you're live, and I'm okay with that because we're human and it's okay to be human, right? Okay. So you can probably now begin to see the screen. You can view our previous or future versions of our Living Sickle Smart sessions by going to our website, which is basically going to kick you to our YouTube channel. And that is where we have a repository of all of our videos that we've done, both in this series, last year's series, and any webinars and things that we've had. And so please join us there. Thank you again for joining us for our fall winter session of Living Sickle Smart and better understanding the role that Be The Match plays in the curative therapy space for sickle cell disease. Thank you, Dr. Oletta. Thank you, Tamara. Thank you, Bilan. We are so incredibly grateful for all that you do. And we encourage all of you to, if you are a warrior or caregiver, sign up for the package, the Sickle Cell Warrior package at sicklecellconnect.com. Okay, sicklecellconnect.com. And if you are interested in learning how you can sign up for Be The Match, you can go to the website as well to learn more. You can even contact us here at Sickle Cell Foundation of Minnesota, and we will get you in contact with Be The Match and connect our community to our cure. All right, thank you everybody for joining us. Have a wonderful day.
Thank you so much.